Hi everyone, this is Kathy Green, Marketing Manager at KidMed. And this week we have Amy Salace, Nurse Practitioner at KidMed, to tell us a little bit about Lyme disease. Now Amy, I know when my kids were small and they get a tick, my biggest fear was they always were going to get Lyme disease. What are some symptoms of Lyme that parents should look for?
Yeah, so Lyme is a multi-stage, multi-system bacterial infection that's transmitted from a bite from a deer tick. It's an illness of progression, so we typically see symptoms over time, especially if it's not caught or treated in the very early stages. In terms of signs and symptoms, the first sign that we'll see clinically is the erythema migrans rash, which is that classic bullseye lesion or target lesion rash that occurs typically right at the site of the tick bite, anywhere between 3 and 30 days after the initial bite. If that is missed or left untreated, that's when it can then progress later on, weeks to months later, to flu-like symptoms. So that's when we'll start to see fevers, joint pain, chills, fatigue, body aches, that type of stuff. And then months to years later, if it's left untreated, that's when it can actually enter the bloodstream and then affect the heart and the central nervous system.
So if I feel like my child has Lyme disease, or I bring them to KidMed and you say they do have Lyme disease, what are the treatments?
Yeah, so it is a bacterial infection, so we treat with antibiotics. The drug of choice for Lyme disease is doxycycline. The duration of therapy really depends on what stage of the illness that you're in. So if you're in the earlier stages, which is the bullseye rash, you'll be treated for about 14 days. If it's any, later on in the course of the disease, the treatment will be a little bit longer, anywhere between 21 and 28 days. A recent change made by the American Academy of Pediatrics is the recommendation now to treat with doxycycline at all ages. It used to be contraindicated under the age of 8 due to the risk of teeth staining. But they're now saying that you can treat kids under the age of 8 with doxycycline just as long as you're doing treatment durations of 21 days or less. So if you're needing to treat longer than 21 days, if it's a little bit later on the course of the disease, then we'll use something like amoxicillin for the younger kiddos.
Okay, and are there suggestions you have to prevent getting bitten by ticks or getting Lyme disease?
Yeah, so there's no vaccine currently, unfortunately, to prevent Lyme in humans. So I always recommend, if you're going outside, especially into a wooded area, just to make sure your child is dressed appropriately. So wearing long pants, closed-toed shoes, hats. Of course, when you're coming inside, you want to make sure to do a full inspection of your child from head to toe, especially in areas like the scalp, behind the ears, the groin area, the armpits. And then, if you do identify a tick on your child, I recommend just removing it as soon as possible. So taking a very sharp pair of tweezers and kind of grasping the body of the tick and pulling upward in a single motion rather than doing kind of any twisting, which can the tick can remain embedded in the skin, or at least fragments of the tick can remain embedded in the skin if you're twisting. So really one of those single upward motions is what's recommended. And then if you are concerned that the tick has been on there for a period of 36 hours or longer, that's when I would recommend that your child be seen either by us or your pediatrician, just so we can take a look, and in certain situations we can prescribe a preventative or prophylactic treatment, which is a one-time dose of doxycycline, which can reduce the risk of developing Lyme after you've had the tick bite. So there are certain criteria that do need to be met in that situation. So the tick does have to be attached for 36 hours or longer to transmit the Lyme bacteria. So that's one of the criteria, is that it's been on there for 36 hours or longer. The prophylactic treatment does have to be started within 72 hours of the tick being removed, and then the tick also has to be identified as a deer tick. So I always recommend bringing a picture of the tick that was on your child, or bringing it in a plastic baggie. There's a lot of other ticks, like Lone Star ticks, for example, that don't transmit Lyme. So bringing that tick in so we can identify it to see if you would qualify for that treatment.
That's great information. And I remember when my kids were little, every time we would go hiking or camping, the first thing we'd do when we got home was tick check.
Yeah.
Check every inch of their body. They complained, but it was a great way because we did find ticks on them occasionally.
Absolutely.
So thank you very much, Amy, for your time. If you have anything you'd like to hear one of our providers talk about, please send me an email at info@kidmedva.com. Once again, this is Kathy Green, Marketing Manager with KidMed.